Welcome to Blocking the Flame, Anakinra and COVID. I'm your host Gaganasri, and today's episode we are diving into one of the more complex aspects of long COVID, the neurological symptoms that many patients are experiencing. We'll also explore whether Anakinra, a drug known for its role in controlling inflammation, might offer some relief for these symptoms. Today we are joined by Aseema. Welcome back to the show, Aseema.
Thank you so much, Gaganasri, for having me again. And I'm really excited to discuss this critical issue with you, neurological symptoms in long COVID. It's a topic that's still unfolding, and there's so much that we need to understand.
Absolutely. And this is something many people don't realize. Long COVID isn't just about fatigue or respiratory issues. A significant portion of patients also experience neurological symptoms that
Mhm.
continue long after the acute infection resolves.
Yeah.
Seema, can you help us navigate through the neurological manifestations of these long COVID symptoms and what are the common symptoms people might not even associate with?
Yeah, absolutely, Gaganashri. So the neurological symptoms in long COVID are quite diverse and can vary widely as well. Some of the most common symptoms include brain fog, where patients experience trouble in concentrating or even thinking clearly. And there's headaches, dizziness, sleep disturbances, and memory problems. There's also cognitive impairment, where it impacts both short term memory as well as the ability to perform the everyday tasks. In some cases, patients also report more severe issues like neuropathy or even anxiety, which seems to stem from the neuroinflammation. And what's particularly concerning is that these symptoms can persist for weeks, months, or even longer. And they can be so debilitating that they significantly affect a person's quality of life. And many patients report that these symptoms can appear despite having had a mild case of COVID as well.
I can imagine how frustrating that must be for patients, but it underscores that long COVID is a multifaceted condition. You mentioned neuroinflammation. Could you break that down for us? What exactly is happening in the body when this inflammation arises, and how does it affect the brain and nervous system?
Well, neuroinflammation is essentially the immune system becoming activated inappropriately within the brain and the nervous system. The immune system is usually tasked with defending the body against infections and injuries, but in case of long COVID, viral particles or immune responses triggered by the virus may continue to stimulate the immune system even after the virus is gone. So, this prolonged activation leads to inflammation in the brain, which is often the root cause of many neurological symptoms. Pro inflammatory cytokines like IL-1, which is a key player in immune responses, can cross the blood brain barrier, which usually protects the brain from harmful substances. And once these cytokines enter the brain, they contribute to inflammation, disrupting normal brain function and also resulting in symptoms like brain fog, cognitive impairment, and headaches.
So it's like the body is stuck in a state of defense even after the enemy is no longer present.
Right.
Now let's bring Anakinra into this conversation. We already know that it works by blocking IL-1, a crucial player in inflammation. Could it play a role in reducing the neuroinflammation that's causing these persistent neurological symptoms?
Yeah, exactly, Gaganashri. So, Anakinra is an IL-1 receptor antagonist, which means that it blocks the actions of IL-1, which is one of the primary cytokines that is driving inflammation, right? And by inhibiting IL-1, Anakinra could potentially reduce the inflammation in the brain, thus helping to alleviate the neurological symptoms of long COVID, such as cognitive dysfunction and brain fog as well. Also, while clinical evidence specifically targeting neuroinflammation in long COVID is still in its early stages, the hypothesis is quite compelling. Anakinra has already shown effectiveness in reducing systemic inflammation in other diseases like rheumatoid arthritis. And the hope is that it could do the same in case of long COVID. And it works as if it works as expected, it could offer much needed relief to patients suffering from persistent neurological symptoms.
That sounds promising. But as you mentioned, we are still waiting for more robust clinical evidence.
Yeah.
Are there any studies or trials exploring anakinra's effects on neurological symptoms in long COVID?
Yes, there are ongoing studies, but we are still in the exploratory phase, and some early research has shown that Anakinra might help with general symptoms of long COVID, including the neurological ones. But one of the initial studies suggested that it could also help improve fatigue and cognitive impairment, both of which are closely linked to neuroinflammation. However, specific studies focusing on anakinra's impact on neuroinflammation and long COVID are still being conducted. Some are looking at whether early treatment with anakinra, especially in patients who show clear signs of neuroinflammation, could reduce the severity of symptoms and prevent further damage. And while we are seeing promising early results, more research is needed to definitely prove its effectiveness and determine the best way to use it in this context.
It's definitely exciting to think that something like anakinra, which has been used for other inflammatory conditions, could play a very important role in treating these neurological symptoms.
Yeah.
As always, it's important that we proceed cautiously until more evidence comes through. To wrap up, Aseema, what do you think is the next step in research for addressing neuroinflammation in long COVID?
Well, the next step is conducting large, well controlled clinical trials that focus specifically on neurological symptoms in long COVID. And we need to understand which patients will benefit most from treatments like anakinra, as well as the ideal timing, dosage, and duration for its use as well. And moreover, we need to continue exploring the underlying mechanisms of neuroinflammation in long COVID, whether it's viral remnants, immune system dysfunction, or something else entirely. This will help us determine not only if anakinra is the right solution, but also if other treatments could complement it or provide more targeted approaches.
Great insight, Aseema. It seems like we are at the cusp of some really exciting developments in the treatment of long COVID, especially concerning its neurological effects. There's a lot to look forward. Thank you for joining us today and sharing your expertise with us. It's been a pleasure to dive into this important topic.
Thank you so much for having me. It's been wonderful discussing the potential of anakinra and the role of neuroinflammation in long COVID.
In our next episode, we'll explore another critical topic, which is post-COVID fibrosis. We'll examine whether modulating inflammation with anakinra could help reduce or prevent long-term tissue damage, particularly in the lungs. And to our listeners, thank you for tuning in another episode of Blocking the Flame, Anakinra and COVID. As always, while we explore the science behind these therapies, remember to consult healthcare professionals for any medical advice. Stay tuned for more.